Hello, I'm Chris Hacker, Registrar and CEO of the BC College of Oral Health Professionals. Flowing from BCCOHP's board's directed strategic priorities, we are creating a new set of cohesive professional standards that will support the delivery of safe care by the oral health team. The standards will set clear expectations for oral health professionals and articulate clear patient outcome statements. We're so pleased to be sharing the draft standards with you for consultation. This is your opportunity to share your perspective, helping us shape standards that are clear, practical, and aligned with our shared goals. The following video will introduce our approach and outline the details of this consultation opportunity. Thank you for being part of this important work.
When BCCOHP came into existence in 2022 via amalgamation, pre-existing standards from our 4 legacy colleges transferred over unchanged. As a result, there are currently 4 sets of standards in place. BCCOHP has developed a new standards framework that aims to create one modernized set of standards that apply to all oral health professionals. The draft professional standards for the oral health team are the first part of this framework. Let's start with the basics. What are these standards? Professional standards are the minimum requirements for professional and ethical performance, conduct, and behavior for regulated oral health professionals and their teams. The professional standards are a core part of our overall approach to standards and apply to all oral health professionals. BCCOHP will use the standards to ensure the oral health professionals we oversee practice confidently and to investigate complaints. Although these standards set requirements for oral health professionals, they were drafted with patients and the public in mind. So why make this change? It's all about modernized right-touch regulation that is focused on outcomes. BCCOHP is committed to developing standards that are written for the whole team, patient-centered, focused on risk, and principle-based. We've taken a team-based approach, recognizing the importance of collaboration within oral health care. The draft standards are written for the whole oral health team, requiring all members to know and follow the same set of standards. By encouraging team-based care, we aim to foster a collaborative environment that enhances both patient and professional safety. At the heart of these new standards is the patient interest. The draft standards are designed to be clear, transparent, and accessible to patients and the public. Written in plain language, they include patient outcomes so individuals can understand what to expect from their oral health team and advocate for their own care. Our goal is to take a risk-based approach to standards, ensuring we're making proportionate decisions that support patient safety. Overall, there will be fewer detailed and role-based standards. In areas where there are higher risk to patients and the public, specific standards will be created and implemented. The new draft standards are principle-based. They are written broadly to ensure flexibility and adaptability over time. This approach allows professionals to use their judgment in patient care, adapting to each patient's unique needs, and emphasizes patient-centered outcomes, keeping the standards relevant and inclusive over time. The draft professional standards will replace the existing Code of Ethics and Standards of Practice, aiming to be clear, accessible, and enforceable. By reducing the number of documents and focusing on principle-based standards, we're making it easier for oral health professionals and the public to understand what's expected. Thank you for taking the time to watch this video and for taking part in our consultation on the draft professional standards. Your input is essential and will be used to shape and inform our standards, ensuring they are effective and that they keep patient safety at the forefront.